We have to integrate the spiritual and the psychological. And this is something that I saw early on in my path to navigating Islamic psychology, is we have a tendency in our communities, in our, ummah, to separate the spiritual and the psychological, where we want to just approach any problem, especially mental health problems that affect our psyche, like waswasa, problems that affect our mental and emotional well-being, like negative thinking. We want to approach it just through a spiritual lens. And we don't do this with other things. We don't do this with physical issues. Imagine if someone had a physical health problem and all you did was tell them to just giving them a solution from a spiritual perspective, telling them this is because of shaitan, telling them to pray on it, telling them to read more Quran. And I think we go from one extreme to another. Either we just approach things spiritually, or we just approach things psychologically and neglect the spiritual. We neglect the Quran, we neglect dhikr, we neglect the prescriptions of Allah subhanahu wa ta'ala. And the reality is that we are an ummah of balance, where we should look at things holistically and integrate both worlds. Just as we would tell somebody who has a physical health issue to pray, read Quran, strengthen their iman, but go to the doctor. Seek those who are medically trained to help you. Unfortunately, with the mental health world, it's not treated the same way. And so you have a lot of people who are not clinically trained talking about disorders like OCD and anxiety in a way just from a spiritual lens. And this causes harm, by the way. And this is why it's an amana, to make sure that the people who are teaching different topics are qualified to teach in those topics. Because it causes harm when you tell someone, for example, who has OCD, who their level of waswasa, the intensity of waswasa, the intensity of intrusive thoughts disturbs their level of functioning. It is harmful to tell them a solution just through a spiritual lens, because we have psychological facets that we also need to learn to navigate. We also need to learn skills to approach problems like that. Just as a person who has a physical health issue needs to learn, maybe, take certain medicines. They need to learn, to interact with that problem differently, that physical problem. Maybe they need to eat different foods in addition to the spiritual work, right?